एक मिनट बाद well, here I am showing you an image of a cirrhotic liver in which this is the outer surface, this is the raised echogenicity of the liver, and the coarse texture is also in front of you. This is the portal vein, this is the gallbladder, and the walls of the gallbladder always appear thick in cirrhotic liver in most of the cases, and this is the thickness of the wall that you are seeing is because of the adjacent cirrhotic liver. Now this is the inferior vena cava, this is the portal vein, IVC, and you see an echogenic area, evenly echogenic area within the IVC, measuring approximately 14 millimeters. And okay, now this is the inferior vena cava in transverse section, and this area is a clot formation within the IVC. This area is evenly echogenic and is suggestive of clot formation in the inferior vena cava in transverse section. This is the transverse section. Now in longitudinal section, when I rotate it, now keeping it here, let's show you from where I was showing you first. Here, this is here I was. You can still see an echogenic area within the IVC. This is the portal vein, and now when I move the probe 90 degrees, this cystic area that you were seeing becomes tubular, and you can still see that this is the IVC in longitudinal section now, and this evenly echogenic area is suggestive of a clot formation within the IVC. This is the gallbladder. It contains few calculi within it. This is the cirrhotic liver. This is this way. You can see that the outer surface of the liver is irregular. This is the coarseness. This is the regular outer surface, and there is fluid around the interior surface of the liver. It is surrounded by fluid. This is the irregular outer surface of the liver. This is the fluid, and this is also the fluid. Coming again to the same pathology that I mainly wish to show you in this study is the formation of a clot within the IVC. Now, this is the transverse section. This is the transverse section of the IVC. This is the clot within the IVC. This is the portal vein, the liver, and this is the right hemidiaphragm. And when I move the probe 90 degrees, you will see the echogenic area. Now there is now this is the left lobe of the liver in the longitudinal section. This is the left hepatic vein. So Now again concentrate on this area, the transverse section of the IVC with the clot within, and now I'm moving the probe 90 degrees. You can see that in longitudinal section even there is a clot that is so far non-obstructive, because the rest of it is not occupying all of the lumen and not blocking the total IVC. This is a magnified view to show you and why it is really a hepatic vein. See the curve. This is a typical curve of the IVC, and secondly, you will see that this left hepatic vein will be entering the IVC. So there is a clot formation within the IVC in this section of the study. Once again, this is the inferior vena cava. This is the clot inferior in the inferior vena cava. Now we show that this is inferior vena cava and not some of the cystic area. Where had it been a cyst, it would have not changed its shape. And had the portal vein is not portal vein because you can see the portal vein is here. This is the portal vein. This is the IVC. This is the gallbladder with two tiny calculi within it, and the liver is cirrhotic. Portal vein is patent and not dilated. This is the maximum dilation that I can show you of the magnification that I can show you on my machine, and you can see that the clot is there. So this is the lumen of the inferior vena cava. This is the clot. Remember the shape of the clot. Persists in the same location. So this is a short study regarding the clot in the inferior vena cava. Thank you. This liver study is regarding the parenchyma of the liver with the here I am showing you the whole liver, and you can make up the coarseness, the irregularity of the outer surface, this is to show you the outer margin of the liver. It is irregular. The parenchyma shows diffuse increased echogenicity with coarseness, with blurred hepatic vein margins. These are the hepatic veins. See the blurriness of the margin, see the coarseness of the liver, see the gallbladder wall, shaggy wall. Though gallbladder is by itself normal, but the anterior wall appears much brighter compared to the normal. This is the portal vein. and here we will see the portal vein branches in the left lobe of the liver in transverse section. This is the left lobe of the liver in transverse section. This is the caudate lobe, ligamentum venosum. This is the ascending portion of the left portal vein, and these vessels that you are seeing are that of the portal vein, irregular outer margin, and coarseness of the liver parenchyma. All these findings are suggestive of cirrhotic liver. Thank you. Video segment relates to the study of liver parenchyma. This is the longitudinal section of the left lobe of the liver, and you can see that the outer surface is irregular, margins are rounded. This is the portal vein, and in transverse section, that of the left lobe of the liver, you will be able to see the irregularity of the outer surface. See, this is the irregular outer surface. See the diffuse increased parenchymal eco-brightness or ecogenicity, and the coarseness that is seen in it. And due to the coarseness, the vessel margin is seen blurred. This was a magnified view. लंबा सारा लंबा सारा है रोक लो. Now, see the gallbladder wall. The gallbladder wall will show a very characteristic appearance, maybe so this is one form of the gallbladder wall. You will see the shagginess of the wall. This is the right lobe of the liver. This is the kidney with liver. You can easily make out that this liver is not normal. There is not only increased ecogenicity, there is coarseness as well, and in such livers where there is no importance of comparing them with the renal parenchyma, the outer surface is of importance always. Magnify a bit and see the outer surface is irregular. Not too much, but definitely irregular. Patient in left lateral decubitus posture, and you can see the coarseness of the liver parenchyma, that of the right lobe, along with mild irregularity of the outer surface of the liver. This is the outer surface of the liver. Moreover, लंबा साल है कि सालों लोग now, sorry. See that this is middle hepatic vein, and note the degree of blurriness of the margins of this vessel and the coarseness, enhanced coarseness adjacent to it. So this is a case of cirrhotic liver with liver parenchymal changes, irregular outer surface, blurred vessel margins, shaggy walls of the gallbladder. This is stage 1 cirrhotic liver with no fluid seen surrounding it. Thank you. Now this is segment 5 regarding the evaluation of the liver span by real more ultrasound. Now this is a liver which is seen below costal margin when I give a sweep to the probe below the costal margin. You see? I place the probe in this direction and then I give a sweep down up to this level. Lower costal margin from here to here, and I can clearly see liver below costal margin as we are here. This is how I am giving a sweep to the probe, and I see the liver below the costal margin. So this is number one. Secondly, now this is suggestive of the fact that the liver is enlarged. Now how much is it enlarged? See that the liver angle, well, it's not sharp, it is rounded. It's not sharp, it's rounded. Now see the kidney. Does the liver exceed the lower pole of the kidney or not? Patient is in supine posture, and here you see that the kidney, lower pole of the kidney. Let me get a better view. एक लंबा सा like this are okay. Well, here you see that the lower pole of the kidney. This is the lower pole of the right kidney, and this is the liver here. So the liver does not exceed the lower pole of the right kidney, thereby suggesting that this is a minimally enlarged liver. Only thing is, two findings are seen. One, the liver is below the costal margin. Second, we do see rounded liver angle. It's not sharp. If we try to measure as per the routine that is being used, then it measures 147. Now, between 12 to 16 centimeter is considered as normal. So if we use this technique, which is in practice, then the liver span is 14.7, thereby suggesting that the liver is within normal limits. The liver span is normal, whereas it is not. It is seen below costal margin. The angle is rounded, and the liver does not exceed the lower pole of the right kidney, thus suggesting that this is a minimally enlarged liver. So this is segment study number 5. Lamba sara cover. Now, if I ask the patient to take a deep breath and hold it, then what you see, now if you get a patient, if you see a patient with liver seen below costal margin, rounded liver angle, and the liver exceeding the lower pole of the right kidney, as for example here, then you can say, well, the liver is minimal to moderately enlarged. Sabakat. as you can see there. In this case, the liver does not exceed the lower pole of the right kidney. This is the lower pole of the right kidney, and this is where the liver ends. So this is basically a minimal definition of a minimally enlarged liver. Thank you very much. This is segment 1 on demand, that how to measure the liver by ultrasound, the span of the liver by ultrasound. Now this patient is in supine posture. This is the liver in front of you. The practice is that you get the kidney and the liver together, and then let me magnify a bit, and then we measure it from the diaphragm. This is the hemidiaphragm, right hemidiaphragm. This is the right kidney in longitudinal section, and this is the liver. So we measure it from the diaphragm to the liver angle. Now this is the liver angle. Now once you measure like this, this shows you that the liver spans 12.2 centimeter, and the normal dimension of the liver is considered to be from 12 to 16 centimeters. Now this liver, by this method that is being used very widely, is at the lower margin of the normal. But as I have already said in many video segments uploaded so far, that we cannot measure, we should not measure the liver in centimeter or millimeters by ultrasound. The reason is that by real mode method, you cannot measure the liver in centimeters or millimeters. It's only by A mode that the liver can be measured in centimeters or millimeters. It will be quite insufficient, if it will suffice if we only give the liver in regarding, you should only say that the liver is enlarged or not. Let's say now this liver is not shrunken and is not at the lower margin of the, as you can see, this is the liver span. Now here, this is the left lobe in transverse section. Lamba saal hai kaisa roko. This is the lamba saal roko. This is the right lobe, and this is the left lobe. Saal roko. Now by none of the parameters is the liver shrunken or is small or enlarged, or say it is, if it is 12.2, then it is at the lower margin of the normal, whereas this liver is absolutely within normal. So what we should do is that we should just place the probe below the costal margin, give a sweep, patient supine, give a sweep from the epigastric region down, come below the costal margin, give a sweep down, and you should not be able to see the liver below the costal margin. So in this case, in this patient, we are not seeing the liver below costal margin. Now, keep one thing in your mind, that there is only one condition in which you can measure the liver in total, and that is when the liver is shrunken. Otherwise, when the liver is shrunken, yes, in that case you can give the measurements of the liver in centimeter or millimeter. If the liver is not shrunken, just give liver is enlarged or not. And secondly, if it is enlarged, then is it minimally enlarged? Is it minimal to moderately enlarged? Is it moderately enlarged? There are certain parameters to define this, which I have already uploaded on many video segments, and okay, I will repeat it as it has been requested for. Thank you very much. This is the part 1. Here we are seeing the normal liver. Thank you.